Hello everyone, welcome back to our YouTube channel, Dental Mnemonics, the channel where learning is smart and fun. We are again back with our Cracking Neville's Oral Pathology series, and today we will be discussing the most common cause of anemia, at least in the US, which is Iron Deficiency Anemia. I might also cover other types of anemia in my upcoming videos depending on the response of this video. So without further ado, let's begin with the introduction. As I mentioned, iron deficiency anemia is the most prevalent type of anemia in the US and around the globe. It occurs when the body either loses more iron than it absorbs or doesn't get enough iron from the diet. There are four main conditions under which iron deficiency anemia typically arises. They are when there is excessive blood loss, or when there is increased demand for RBCs, or when there is increased intake of iron, or where there is decreased absorption of iron. So let's talk about each of them briefly. First, talking about excessive blood loss. In women, especially those of childbearing age, up to 11% are iron deficient due to chronic blood loss from excessive menstrual flow or menorrhagia. While talking about men, around 1 to 2% of adult males are iron deficient, often due to chronic blood loss associated with gastrointestinal diseases such as peptic ulcer disease, diverticulosis, hiatal hernia, or even malignancies. So now moving on to the second cause, that is increased demand for RBCs or red blood cells. So when the children undergo rapid growth, their body requires more oxygen, so it increases RBC production, which is called erythropoiesis. Since hemoglobin in RBCs it contains the iron, insufficient dietary iron can result in anemia, resulting in iron deficiency anemia. Similarly, during pregnancy, the mother's blood volume expands to support the baby and placenta. This requires the production of many more red blood cells, demanding a higher iron intake. If this need isn't met through diets or supplements, then iron deficiency anemia can develop. That's why the increased demand for RBCs is usually seen during growth spurts and during pregnancy. So now coming to the third cause, that is increased intake of iron. So this is common during infancy, especially when diets are limited to low iron foods like milk and cereals. Likewise, older adults may have poor iron intake due to dental problems or financial constraints, limiting access to iron-rich foods such as meats and vegetables. Also, an important point to remember is that in developing countries, intestinal parasites, especially hookworm, are a significant cause of iron deficiency anemia in both children and pregnant women. I have included a small mnemonic later in our upcoming slide for this. So now let's cover the final cause or the fourth cause, which is decreased absorption of iron. This means the body is not absorbing enough nutrients, even if the diet is adequate. Although rare, it occurs in certain medical conditions, such as complete gastrectomy, where there is the surgical removal of the stomach which impairs the nutrient absorption. Also in celiac disease, where the gluten damages the intestine, causing nutrient malabsorption. And also in inflammatory bowel disease, especially Crohn's disease, which can inflame and damage the digestive tract, making iron absorption difficult. So now moving to the clinical features. As expected, individuals with iron deficiency anemia often feel fatigued, easily tired, experience palpitations, lightheadedness, and a general lack of energy. This is because reduced hemoglobin leads to poor oxygen delivery to tissues. Other symptoms are shown in the figure, which we will break down using an easy mnemonic in the next section. For now, just remember these important key signs. Now coming to the laboratory investigation, the hemoglobin, which is the amount of oxygen carrying protein in the blood, it decreases in iron deficiency anemia. Similarly, the hematocrit, which is the percentage of blood made up of red blood cells, is also lowered when you have iron deficiency anemia. Also, the number of RBC count, they are often lowered in iron deficiency anemia. MCV, it measures the average size of the red blood cell, and they are also usually less in iron deficiency anemia. Talking about the MCH, it is the amount of hemoglobin in each red blood cell. It is also lowered, and the serum iron, which is the amount of iron in the blood, is also low. And the total iron binding capacity, TIBC, it stands for how much iron your body can carry. It is high when iron is low, that the body tries to get more iron. Talking about the transferrin saturation, which is the percentage of iron binding protein field, it is also lowered. The ferritin, which is the amount of stored iron in our body, it is also lowered. And the reticulocyte count, which is the new RBC being made, it is also low. So to summarize, like the every levels of iron and ferritin levels, they are low in iron deficiency anemia due to depleted body iron stores. The only thing that is elevated in iron deficiency anemia is the TIBC, or the total iron binding capacity, which is elevated as the body tries to catch and hold on to more iron by producing more transferrin. So the red blood cells, they are also small, which is called microcytic, and also pale, which is hypochromic. So the RBC in iron deficiency anemia, they are microcytic and hypochromic due to reduced hemoglobin. So I hope this makes it clear about the laboratory investigation. So just remember, like the amount of MCV, MCH, ferritin, transferrin, everything is lowered. The only thing that increases is the total iron binding capacity for iron deficiency anemia. So now let's discuss about Plummer-Vinson Syndrome, a condition that shares features with iron deficiency anemia but comes with some added characteristic. It is also called Patterson-Kelly syndrome or sideropenic dysphagia. To break it down, sidero means iron, penic means deficiency. So it literally means iron deficiency dysphagia. So think of it like this. We know the job of a plumber is to dig. So the plumber digs, and the name of the plumber was Pat. So here Pat can remind you of Patterson-Kelly. So talking about dig, the D stands for dysphagia, I stands for iron deficiency anemia, and the G, it stands for glossitis. So patients with Plummer-Vinson syndrome often complain of difficulty or pain while swallowing, called dysphagia, and upon evaluation either via endoscopy or barium swallow studies, we will typically find esophageal waves, which are abnormal tissue bands in the esophagus, as you can see in this figure. So from the esophagus, here's another key point about Plummer-Vinson syndrome. So they have a high risk for both oral and esophageal squamous cell carcinoma, so it is considered a pre-malignant condition. So don't forget about this important point of Plummer-Vinson syndrome. So now let's use a fun mnemonic to remember the features of Patterson-Kelly syndrome, which again shares all the features of iron deficiency anemia. So we usually eat with stainless steel or plastic spoons, right? But imagine if the spoon was made up of iron. So what could it lead to? This obviously causes discomfort in the mouth, leading to a burning sensation or atrophic glossitis. And now let's imagine someone who has a craving to eat sand or clay instead of normal food. So they are bound to get a fungal infection, obviously, right? So let's break each of the points. So here I said iron spoon because the iron spoon reminds us of koilonychia, where the nails become spoon shaped or brittle. So persons suffering from iron deficiency anemia or Patterson-Kelly syndrome or Plummer-Vinson syndrome, they have these features of koilonychia, where they have this spoon shaped nail or the nails are brittle. And eating with such a spoon could cause burning tongue or discomfort in tongue, called atrophic glossitis, and also mucosal atrophy. And the desire to eat sand or clay is called pica, and from sand, remember Scandinavian, SAND, Scandinavian, because Plummer-Vinson syndrome commonly affects Scandinavian or Northern European women, usually who are 30 to 50 years old. So remember I said about the hookworm infestation. So now remember this phrase like hooking the food into your mouth with a iron made spoon. So it symbolizes how in developing countries hookworm infestation is a major cause of iron deficiency anemia. So here's a picture where your tongue looks kind of beefy red, which is called atrophic glossitis, where there is a depapillation of the lingual papilla, atrophy of the lingual papilla, and this is the spoon shaped nail, which is termed as koilonychia or the brittle nails. So it is obvious, right? If you are eating with a spoon that is made up of iron, then you are to get fungal infection, and whenever it comes to fungal infection, the most common is oral candidiasis and angular cheilitis. So this is the figure showing the oral candidiasis or thrush and angular cheilitis, which we see at the corners of the mouth. So this is also the oral manifestation of both iron deficiency anemia and Plummer-Vinson syndrome. So now coming to the treatment for iron deficiency anemia and especially Plummer-Vinson syndrome, this flowchart can be very useful. So once iron deficiency anemia is confirmed, we start with oral iron supplementation and also monitor the patient's response. So if the symptoms improve, we continue the therapy. If not, we consider other causes or switch to the IV iron. If the patient they experience dysphagia, then mild cases can be managed with iron therapy, while severe cases it requires endoscopic dilatation of the esophageal waves. So the long-term care, it includes iron maintenance, nutritional support, and surveillance for esophageal cancer, especially in case of Plummer-Vinson syndrome. So before I end the video, so here's a summing up table for iron deficiency anemia. So the deficiency of anemia is you have the low iron, where there is the reduced hemoglobin because of low oxygen delivery, and there were four main causes: chronic blood loss, increased demand of RBC, decreased intake, and decreased absorption. So loss, demand, intake, and absorption. In women, the most common cause is due to menopause because of heavy blood loss during periods, and the most common cause in men is gastrointestinal diseases like peptic ulcer, diverticulosis, hiatal hernia, or some malignancies. And talking about infants or elderly, it may be because of poor diet or milk only diet in infants or difficulty in eating in elderly. And I said the phrase like hooking up in your mouth with iron made spoon can cause anemia. So hookworm infestation is very common cause in developing countries. And talking about the clinical features, this is a very obvious feature since there is blood loss. So patient is fatigued, he has palpitations, lightheadedness, pale skin, and also pica, where they crave to eat sand or clay. And talking about lab features, everything decreases: the amount of iron, ferritin, hemoglobin, MCV, MCHC, and also the type of RBC is microcytic hypochromic. The only thing that increases is the TIBC or total iron binding capacity. And coming to treatment, we do the oral iron supplement, we check the response, and if needed, then intravenous iron supplements can also be helpful. So finally, summing up for Plummer-Vinson syndrome, its other name is Patterson-Kelly syndrome or sideroclinic dysphagia. And remember, Pat was a plumber, so what does a plumber do? Digs. In which D stands for dysphagia, I stands for iron deficiency anemia, G stands for glossitis. And the cause of dysphagia is because of esophageal waves, which we see in endoscopy or barium swallow. And I said that the person they eat with spoon made of iron. So this reminds us of spoon nail or koilonychia, eating with iron spoon. As a result, they will have discomfort in their tongue or burning tongue or atrophic tongue, and they have a craving for sand or clay material, pica. And here's sand, it's similar to scand or Scandinavia. So this says that PVS they have a higher predilection for Scandinavian and Northern European women. And like when you eat something with such material of a spoon made of iron, then it's obvious that you're gonna get fungal infection. Whenever it comes to fungal infection, the most common ones are oral thrush or oral candidiasis and angular cheilitis on your corners of the mouth. And very important thing to remind of Plummer-Vinson syndrome is that it has a it is a pre-malignant condition, so they have high risk of oral and esophageal SCC. So how to remember it? We said that like the Plumber disc, D was for dysphagia. It was because of esophageal waves. So from esophagus, we remember that it has very high predilection for both oral and esophageal squamous cell carcinoma. Hence, it is a pre-malignant condition. And talking about treatment of Plummer-Vinson syndrome, we try to do the iron therapy. If esophageal dilation is required, we do that. If there's severe cases of dysphagia, and we monitor the iron level. And the main thing is we need to screen for squamous cell carcinoma, in which long-term surveillance is required. So that's it for today. If you like this video, please give us a thumbs up. If we get good feedback, I'll be happy to continue this series with other types of anemia. If there's any content, video or trick you would like on any topic in dentistry, drop a comment below and don't forget to subscribe our channel. All the links are in the description box. So until next time, take care and goodbye.